was established by University of Kashmir in 2020 under the National Brain Gain Mission. And over the years, it is emerging as one of the brilliant research centers with state-of-art infrastructure and a competitive, conducive research ecosystem. And the achievements of CIRI would not have been possible without the unwavering guidance and support from Honorable Vice Chancellor. The theme of the symposium, bridging knowledge and practice, the power of early cancer diagnosis, is timely and is immensely important, given the increasing incidences of cancers in the valley. Early diagnosis and screening, I think they are our best weapons for the prevention of the cancer. If cancer is caught early, lives are saved, families are kept whole, and hope is restored. Therefore, it is very important that we know the early signs of this disease and take necessary measures so that we can reduce the burden of this disease. This symposium is bringing world-class researchers, clinicians, and public health experts to discuss strategies, challenges, and to see how we can reduce the burden of this disease. But it is also important for our students to see how, what are the causes, what are the underlying reasons for high incidences of cancers in the valley. What is the role of food, environmental factors, and other things which contribute to the disease. And equally important is how we can rope in social science departments to act as a bridge between clinicians, researchers, and society so that the message goes far and wide.
With a specialization in environmental geography, climate change, and disaster risk management fields, in which his contributions are nationally and internationally recognized. He has guided a generation of scholars through his mentorship, shaping the future of environmental research. Professor Bhatt's strategic vision as the Dean of Research has been pivotal in strengthening the University of Kashmir's research output, promoting interdisciplinary collaborations, and securing critical funds for academic innovations. Thank you, sir, for joining us today and for your unwavering commitment to the pursuit of knowledge. Sir, please kindly come over the dais and address this team gathering with your insightful words.
When we are talking about this particular theme of cancer, this is one of the alarming health issues, not only nationally or globally, but we have its serious incidents at the regional level as well. When we will be having a glance at the incidence of various types of the cancers in the Kashmir Valley, some alarming statistics is emerging. During last 1 decade, almost the incidence of the cancer cases has increased many folds in the Kashmir Valley. And as the statistics goes, that so far as the stomach cancer is concerned, it is one of the leading cancers in the Kashmir Valley, followed by the lung cancer, particularly among the male community, and then the breast cancer among the female community. So as a society, we have to explore that what have been the causes which are responsible for the alarming emergence of this very particular disease. Though, while we are analyzing the pan and data, the morbidity and the mortality rates of the cancer, it ranks 5th disease so far as the Indian situation is concerned. And if we are talking about the global scenario, it is the second important disease at the global level after the cardiovascular diseases. But it is quite strange that so far as the various types of cancers, especially when we are talking about the esophageal cancer, lung cancer, liver cancer, and the breast cancer, it has made big inroads so far as the Kashmiri society is concerned. One of the important causes which is being, I mean to say, generally highlighted, that is a unique combination of the dietary and the cultural practices which the society has resorted lately. That with the increasing urbanization, with the changing dietary and changing lifestyle pattern, these are being explained as some of the causes which have contributed heavily towards the emergence of the various types of the cancers in the Kashmir Valley.
As cancer doctors, we see the reality of cancer every day in our clinics, the way it snatches our nears and dears from us. I was recently caring for a young lady in her early 20s who had an unusual cancer in that age, the cancer of intestinal bowel, rectum. She was dying of it. At the periods of most severe pain, this beautiful lady would tell me, Dr. Salim, I want to go back to college. I want to complete my education, graduate and serve. Alas, a few weeks later we lost her to cancer. We lose a lot of people, but they don't go away. We as cancer doctors cherish their smiles. We remember their moments of joy. We remember their periods of pain. Their memories live with us always. They never go away. We in the medical community have been recently alarmed by a few things which are changing in cancer pattern in Kashmir. When we established the medical oncology department in SKIMS in 1987, and those people who were practicing oncology at that time will remember that every other patient who would walk into your clinic had either a cancer of esophagus or stomach. Then you would see an occasional lung, occasional breast, occasional colon, and most of them would be in advanced age. But today, we see breast cancer in girls who are in their early 20s, in ladies who are in their early 30s. We see bowel cancer in young boys and girls. And the numbers are increasing. I think we are seeing almost twice the number of cancer patients today as we would see a decade earlier. I think you will hear the statistics of cancer in Kashmir from Dr. Arshad today. Plus, unfortunately, many of our patients present late. Multiple factors, a bit of patient, but a bit of doctor as well. They come late, cure becomes unfortunately very difficult. 23rd December 1971. This date we Kashmiris remember for a different reason. But as cancer doctors, it has a different significance. That was the day when President Nixon of United States of America signed what is known as the National Cancer Act. And he declared war on cancer, which actually established the National Cancer Institution. From that day till now, billions of dollars have been spent on cancer research, billions. It is no doubt that we understand cancer biology much better than we did then. No doubt, some of the cancer patients are living longer. No doubt, some cancer patients are getting cured. It is estimated that in 2028, this expenditure on oncology and oncological therapeutics will pass $400 billion. That's more than the budget of India. $400 billion.
I feel this is one of the very important activity on which we as academicians and medical fraternity should devise a model for awareness in the community itself, literate as well as illiterate groups, to children, which age group we have to hold for the awareness campaigns in schools. I think probably at the adolescent age, and could be even lower through small, group activities. And I feel definitely maybe we are not able to see the change in the long run. People in future can, see the change. So I will not go on repeating about the CIRI. CIRI is one of our very important research center, well recognized at national as well as global level. But I would definitely like that CIRI take up these activities with, Oncology Forum of Kashmir. Like for example, awareness programs could be in the community itself and in community, to which is our connective group in the community. Ladies are very important. Women should be very important because at home responsible for cooking, nutrition, all that. How does dietary intake play a role in eradicating the cancer, and the lifestyle? See, I'm taking two different, and from medical point of view, the medical fraternity has to take it up, and taking up from the simple things, what should come up from the homes itself, what should come up from the community itself. And we have Department of Social Work, we have Department of Sociology, we have Department of Home Science with Food Science, Nutrition, Dietetics and Clinical Nutrition as specializations. So let there be a module which we can sit, I would definitely love to sit in one of the activities and work on it, because it will be a service to the society, service to the humanity if we are able to work on it. I would definitely love to do something on it, and definitely would like to be more connected, and awareness is one of the important ways for the preventions.
अनफॉर्चुनेटली जो कश्मीर में हो रहा है, कैंसर जो पेशेंट्स हैं वो बहुत लेट डायग्नोस होते हैं, तो इसलिए कश्मीर ऑन्कोलॉजी फोरम विद दिस पर्पस बनाया हमने कि हम अवेयरनेस पे ज़्यादा ध्यान देंगे और अर्ली डायग्नोसिस पे ज़्यादा ध्यान देंगे। मतलब ये कि प्रिवेंशन और अर्ली डिटेक्शन पे ज़्यादा ध्यान देंगे। ये तभी मुमकिन हो सकता है जब हम कुछ सिम्पोजियम, सेमिनार्स और पब्लिक इंटरेक्शंस करेंगे। तो इस तरह से हमने जो आज यहाँ पे ये इवेंट किया है कश्मीर यूनिवर्सिटी के साथ, इसका मतलब ये है कि यहाँ पे जो हम कश्मीर यूनिवर्सिटी की ऑडियंस है, स्टूडेंट्स हैं डिफरेंट डिपार्टमेंट्स के, और हमने अप्रोच किया हुआ है कश्मीर के बहुत सारे नर्सिंग कॉलेज के जहाँ से हमारे स्टूडेंट्स आए हैं। तो ये पहला स्टेप है इसका कि हम कश्मीर इस कैंसर अवेयरनेस के बारे में इन जानकारी इन स्टूडेंट्स तक पहुँचाएँ, जनरल एम्प्लॉयज़ तक पहुँचाएँ, फैकल्टी तक पहुँचाएँ। तो इस तरह से ये हमारा प्रोसेस कंटिन्यू रहेगा। हम डिफरेंट कॉलेजेस में जाएंगे और यूनिवर्सिटी में भी डिफरेंट डिपार्टमेंट्स में कंटेक्ट करते रहेंगे। ऐसे सेमिनार्स हम कंडक्ट करते रहेंगे जिसमें हम ये बताएंगे कि मतलब कैंसर को कैसे अर्ली डिटेक्ट किया जाएगा, इसके वजूहातों से कैसे दूर रहा जाएगा, और फिर इसका ट्रीटमेंट भी बताया जाएगा।
Prevention means three types. It is primary, secondary and tertiary. Primary is okay, we ask some, no, don't smoke, don't take alcohol, don't. That's the primary. Then there is a secondary prevention. Secondary prevention is we take a patient who has a initial disease, benign disease, we go for surgeries, we go for other screening. Then there is the other one which has come recently, that's the tertiary prevention. Tertiary prevention means we try to take the disease at the molecular level. We have these days got the genetic sequencing. If we do a genetic sequencing, suppose there is a BRCA gene in case of breast, in case of ovary. If we know this BRCA gene is present, so we take the measures when disease is not there. This is called a tertiary prevention, which has now coming.
Importance of today's day is to make the people aware about the rising menace of the cancer, especially among the females the breast cancer, and among the males the lung cancer. It is a burning issue because day by day we are seeing the steep and slow rise of the number of the cases. So where we can counteract is to have a primary prevention. By primary prevention we mean that we have to prevent ourselves from getting this disease. So there the main activity we can do is to make the people aware about the causes, the prevention maneuvers, and to change the various dietary and different lifestyle habits the people of Kashmir right now are like used to. So the main reason for the rising trend of the various diseases in Kashmir is the lifestyle modifications they have acquired throughout these years, and the various unusual habits like increased smoking, consumption of alcohol, and the sedentary lifestyles. So our main concern would be to focus on these areas, and at the same time to have the early detection as well as the availability of the various facilities available in the Kashmir area to tackle this disease, and the various modalities we do have to counter the this deadly disease.
One, these patients are young, in their financially productive age, in their reproductively productive age, and these malignancies leave psychological and physical scars on their body, which have an impact, long-term effect on their life. And second thing is that in these patients, in these age groups, we don't have screening guidelines. Whatever screening guidelines that have been framed have been for elderly patients or in a different age group, not for these class of patients. So it is very, very difficult to pick up these patients early. Now, a lot of research has been done in this phenomena in the West, looking at what is the most likely cause, what drives these cancers in these patients in this age group. And what they have found is that the most common reason is our lifestyle. The lifestyle which has changed in past few decades in the West, and that is happening now globally also, and even in Kashmir. Now our lifestyle has become more sedentary. It is our food habits have changed from consuming more processed food, which is high in meat, processed meat, and which is low in fruits and fresh vegetables, and at the same time low in grains and fiber. And this has been complicated by our sedentary lifestyle. Now these type of habits, these things have been shown to drive the cancers in this age group.
From my point of view, this symposium of national is of a good importance, as it not only cares for the tertiary problem, it cares for the primary prevention problem. Prevention which matters in early diagnosis of cancer care. We have seen the patients with increasing number of cancer cases in Kashmir. Now it is time for us to aware public about the early diagnosis and prevention before it takes to the at the later stages. This symposium will have a greater, larger impact on the population, as each and everyone will get to know about what are the primary causes which we can prevent from the cancer.
Professor Altaf Saab, who provided man's support and pillar as far as the coordination with the university was concerned. So thanks to everyone. Thanks to organizing secretaries, as Altaf Saab stands one of them, and Professor Nazir Saab, who have been working day in and day out to make this event successful. We have co-organizing secretaries as well, Dr. Javed Subbat, who was from the University of Kashmir, and two colleagues from the Kashmir Oncology Forum, Mushtaq Ahmed Sofi Saab and Abdul Majid Saab. They also worked a lot to make this event successful today. This event would have not been possible without the sponsorship of ARF, DBT Builder, and BDR Pharmaceuticals. At last and not the least, we are highly thankful to Administrative Block of University of Kashmir Administration, Chief Proctor with all his staff,